When the time comes, would you want to die with dignity at the time of your choosing? If you were diagnosed with a terminal disease, wouldn't you rather choose your time legally rather than suffering and having your loved ones watch you suffer? Hi, my name is Nicole Pringle, and today I'm going to introduce you to the term death with dignity. According to the Assisted Suicide website, there are some states in which various forms of this procedure have been approved. Some states include Switzerland in 1940, Oregon in 1994, Vermont in 2014, and California in 2015. Even though some states have adopted this sad but very glorious freedom, they are still under certain limits, rules, and guidelines, which are all different from each other. Specifically in Oregon, the law to approve assisted suicide was passed in 1997. Since Oregon is the model of legislation throughout the United States regarding death with dignity, we get an annual report. Since the law was approved in 1997, a total of 1,545 people have had the prescriptions written, and only 991 patients have actually died from ingesting these medications. Now, anyone can see that the numbers don't match up, and this is because in some cases, the patient will hold on to the bottle until they are ready to pass, which would lead to their death being on the following year's report, or the patient dies before ingesting the medication. Let me put everyone into the shoes of an actual person who lived in a state that death with dignity was illegal. Her name was Brittany Maynard. Married for a year, trying for a family of their own, and only 29 years old. She was diagnosed with brain cancer after months of suffering from excruciating headaches. After the initial diagnosis, she had gone under for 2 different surgeries in an effort to stop the growing of the tumor. Following the surgeries, she was informed by her doctors that the tumor had not only come back, but it had come back larger and more aggressive than the first time, and that she only had 6 months to live. Due to this, the doctors in her hometown prescribed and recommended full brain radiation, to which would leave her with first-degree burns on her head, no hair, and a quality of life for her remaining time that would quickly deteriorate. Nobody I know would want to finish out their days that way, and neither did Brittany. After doing extensive research, Brittany decided, with the support and love from her family, that she wanted to enjoy her last 6 months of life. This woman had to then uproot her entire life, her memories, any form of normal she'd ever known, because her state did not offer die with dignity. Now I ask you, is that what you'd want to spend your last 6 months of life doing? Moving your family, making new memories somewhere that isn't home? Brittany made that decision and sacrifice and moved to which she got her prescription and picked her day to leave this world, happily, comfortably, and with her loved ones by her side. Now, some people may argue that someone could request and receive these drugs if they are depressed or just suicidal. Well, that's just not the case. In Oregon, you must be 18 or older, a resident, capable, which is defined by the state of Oregon for these purposes as able to make and communicate healthcare decisions, and you must be diagnosed with a terminal illness that will lead to death within 6 months. The states that offer die with dignity all follow their own set of rules, so these are only specific for Oregon. Along with those requirements, the patient must take 2 oral requests with a 15-day separation to their doctor, provide a written request signed by 2 different witnesses, the diagnosis must be confirmed, the prescribing doctor as well as a consulting doctor must determine if the patient is capable, and if either of the 2 doctors have any reason to believe the patient's judgment is impaired, they will send the patient for a psychological exam. So considering this, it's proven that it's not just a quick all-of-a-sudden decision. All of the requirements have to be met, and they help to ensure the actual need for the medication. Death with dignity is something that some people don't agree with for their own reasons. However, for those that are put in the awful position of knowing your life will end in a specific time period, the comfort of knowing they have options could be the only thing that saved them from completely losing all control. If this is a program that you are on board with and agree with, you can make your voice be heard. Become an advocate. Talk about how it can help, how it can bring comfort to others, and help others to understand why it's so important to give ourselves these options, just in case it does happen to us, without having to uproot our families and everything we know to do so. By going to deathwithdignity.org, you are able to see where your state stands on this issue and gather more information about restrictions and regulations. Thank you for listening. This is Nicole Pringle.